We've had these questions from community physicians, and what do we do with these patients? Where do we send them? How can we help them?
The Sainte-Justine Hospital in Montreal has created a special unit for children with long hauler COVID-19 respiratory symptoms, the post-COVID clinic. The clinic opened in April and has seen 10 patients, all teens with a variety of symptoms like chest pain, a severe cough, or trouble breathing.
We had the idea of putting these patients in the same clinic because, honestly, is even in adults, right, this long COVID or post-COVID syndrome, we understand very little about it so far.
It's believed only a small minority of children will have long hauler COVID-19 symptoms after being infected, but Tse says it's an important minority that required special attention. Having lingering respiratory symptoms for at least a month is the main criteria for admission. The children are examined thoroughly once admitted and run through basic lung function tests.
We do several tests. We do some blood tests to look at whether there's persistent inflammation in their body. We do lung function testing as well, because a lot of these kids, like I said, they present with respiratory symptoms. And in kids who have respiratory symptoms only on exertion, we can do some exercise testing as well.
Tse says parents who notice symptoms like coughing, trouble breathing, or muscle pain that last longer than 4 weeks should call to book an appointment for a checkup and trust their parental intuition. Currently, only the Pfizer-BioNTech vaccine is approved for teens 12 and over for use in Canada, none for younger children. Several trials are underway to test the effectiveness and safety of existing vaccines for those 12 and under. Many parents saying they would consider getting their young child vaccinated once approved.
He's already had COVID, and I don't know. I guess I would.
I have 3 kids, but about the vaccine is need for every person.
If after vaccination he go without mask, it's really good for him.
There is still no specific treatment established for children who suffer from long hauler COVID-19 symptoms, but Tse says the clinic is also a place to reassure parents.
Several parents have told us, well, a lot of doctors or professionals that we've seen told me that this is anxiety, this is depression, this is all in your head. And the fact that we kind of just recognize the symptoms and talk them through it, it actually means a lot to them.
In Montreal, Samsara Rainville, City News.